the global pandemic, global vaccination campaign continues, health officials are debating how to distribute second doses. Some countries have already decided to postpone booster shots. Denmark has approved a delay of up to 6 weeks between doses, hoping to protect more people against the virus. And Britain announced last week it will wait 12 weeks before administering final doses. So should we stick to the designated schedule between doses, 21 days for the Pfizer vaccine, 28 days for the Moderna vaccine? Joining me now with more on this is Professor of Medicine at the University of Maryland School of Medicine, Dr. Wilbur Chen. Dr. Chen, I love having you on because you make things simple for us to understand, and this is especially an important topic for you to do that for us. Good morning to you.
Good morning, and thanks for having me back, Jeanette.
Of course. So let's jump right into this. There's different strategies that are being proposed. Delay the second dose or do half doses. Can you break that down for us?
Yeah, these are all strategies that we actually talked about 10 years ago with the 2009 pandemic. And so these are all strategies where you can take fixed or low quantities of doses and try to expand them out to the population. And so if you take a half dose and you give them to people, all of a sudden you've increased your supply by twofold. If you are able to space your doses so that you give the doses instead of 3 weeks apart, 12 weeks apart, you also are able to give more of your fixed doses to more people in a shorter amount of time. However, the trade-off is that we really don't know what the efficacy will be when we make those maneuvers.
I want to get into that because for those of us who aren't medical experts, we think, okay, this can't be safe, but maybe it is if this is something that they're pushing, unless we're just at a point where it's urgent that people have some level of protection. So the question is it safe?
So it's not a question of actually increasing or decreasing safety when we make these maneuvers. It's more of a question of, are they going to result in the protection, the efficacy that we desire? And so we only have studied giving the 2 full doses at the spaced intervals that we've studied. And that's where we know that we have that nearly 95% efficacy, which is terrific. We don't want to have any question about that efficacy. And so that's why I'm not an advocate, and you're hearing from the FDA that they're also not advocates at all of spacing these doses or to have these doses halved.
Is there a precedent for this at all?
Well, the precedence is that we've had the discussions during the last pandemic. And, in times where, say, for smallpox vaccination, there were times, or yellow fever vaccination, we have administered half doses and still been very successful. Those are very powerful vaccines where, again, the half dose does not diminish the immune response and the protection for a short period of time. However, the longevity of those vaccines is what is being curtailed. So again, for those vaccines, which we've studied for a long period of time, we know that the duration of protection might actually be a little bit diminished when we make those maneuvers.
Dr. Chen, I'm hoping you can answer this question because one of the things that people thought about immediately when this was proposed is we're already dealing with a logistical nightmare in terms of just getting the vaccines distributed. And so people are wondering, shouldn't we focus on just the rollout itself? Wouldn't that be the first thing you'd have to address before getting to this part, or is this logistically easier to do?
I completely agree with your notion. And so I think that right now, maybe others are worried about our fixed vaccine supplies and our resupplies that will be later on in Q2 of this year. But I agree with you in that our real problem, the boots on the ground problem with the vaccination clinics that I'm involved with, is that we don't have enough people, enough space, enough IT infrastructure to be able to administer all the vaccines that we have supplied to us. So that's really the bottleneck, is our ability to physically administer these vaccines in safe environments with the personnel that are trained, and to have the IT and all the other infrastructure that needs to be in place for these vaccination clinics to be able to be performed at their optimal speed.
All right. We appreciate you breaking all that down for us. Dr. Wilbur Chen, Professor of Medicine at the University of Maryland School of Medicine. Always great talking to you, Dr. Chen.
Well, thank you.
All right. Mike, I'll send it over to you.
All right, Jeanette, we got a cool